is indeed a priceless blessing, like I would always say. And of course, it is our collective responsibility as a people to prioritize this. Welcome to ILERA EKO Extra on Lagos Traffic Radio 96.1 FM. Good morning, good morning, good morning, dear listener. Of course, as we begin another beautiful day in the vibrant city of Lagos, it's actually raining in some parts of town. So I would say dress warm if you're not already out of the house. But if you're on the road, take it easy. If you're driving, try to, keep to the speed limits. In fact, I would advise you go a tad slower because, of course, when it rains, it gets slippery. That is my safety advice. We begin another beautiful day. And, of course, we appreciate the gift of good health and expressed our gratitude to the Almighty. It's, of course, essential to recognize the importance of having a reliable safety net in place. No one plans to fall ill, that's the truth. But we also know that life's uncertainties can be quite unpredictable. And in view of this, the Lagos State government, through the Lagos State Health Management Agency, LASHMA, introduced ILERA EKO, which, of course, is a revolutionary health insurance scheme designed to provide quality healthcare at a very, very affordable cost. Now, it is part of our ongoing efforts, to sensitize and educate the public about the benefits of ILERA EKO and all the plans therein. And that's what made us come up with the show ILERA EKO Extra, which is your one-stop shop dedicated to sharing the good news of accessible and affordable healthcare. So do me one favor as you listen to us as you head out on the roads, or perhaps you're home or at the office. Relax, give us your attention. Just leave it locked on 96.1 FM as we embark on this informative journey together. Of course, my name is Akan Usen. Now, before I introduce my guest, of course, we have a guest in the studio with us as always, as we do every Monday around this time. We definitely will be talking about a very important topic. It's all about health insurance, the basics of health insurance. And social health insurance for that matter. But of course, I'll be doing a quick detour to just see what the roads are looking like. We had a report of a broken down Lexus Jeep having front tire issues, occupying the service lane at Ilele bus stop in North Mile 12, coming all the way from K2. Of course, I understand the traffic managers were doing the needful while a tow truck has been reached out for onward evacuation of said impediment. It's not really affecting traffic at the moment because, of course, the stretch it is on is the opposite from where we have pressure at this time. From the Ajasa command end, I understand from Adefemi towards Ojuodo Bridge, inwards Kola Junction. Okay, it's still quite heavy, is still very heavy due to flooding, and it's affecting the traffic, but traffic managers are on ground fully managing the traffic situation. So Adefemi towards Ojuodo Bridge towards I think they meant to say Ikola Junction, okay. Yes, incident report from the Ijushaga axis. The earlier reported Volks LT 35 mini truck that was reported, an impediment has been moved off the road. We'll definitely be giving you more traffic feeds as the show progresses. But at this time, let's make welcome our guest. Of course, they'll be, shedding light on the basics of health insurance, and also talking about social health insurance in particular. I'd love to hear from you right there. Wherever you are, we'd love to hear from you. We value your feedback. You know that. We value your questions. We value your inquiries. In general, we value your voice. We want you to talk to us. Let's know how we can serve you better. Let's know if there's any gray area you don't really understand. Feel free to connect with us. 091-538-77127. That's the number to call. 091-538-77127. You can also send a WhatsApp message to 080 991-20777. That's 080-991-20777. I'd love to hear from you. We have with us Mr. Idowu Omotayo. He is sales officer with LASHMA. Mr. Omotayo, you are welcome.
Good morning, presenter.
All right, so of course, I see that this is your first time on the show. Well, I know you might have gone to other stations, yes, but right here on the show, yes. Could you come closer to the microphone? Thank you. Yes. So, of course, our listeners can hear you better. So we'll be starting from the very, very nitty-gritty, from the very foundation. Of course, I'll be pretending I don't know what health insurance is. Let's start from the very beginning. For the purposes of, education, and for those who perhaps do not have a firm grasp of this, or for those who do not even know what we're talking about, let's talk about health insurance. And, why is it important for every individual or family to have health insurance?
Okay, good morning, presenter. Good morning, listener at home. My name is Idowu Omotayo. Health insurance, I can say, is an agreement between the health provider and the people. An agreement? Yes. Okay. What do I mean by saying agreement? Like individual, family, churches, hospital, mosque, companies, in which the health provider agree to pay their medical bills in exchange for a premium payment. Okay. Let me explain further. Health insurance is a contract between the health providers and the consumers.
So there are two parties: health providers
and the consumers.
Consumers, okay.
Who are the consumers? People in the town, individual, family, group of people, sponsors, churches, associations, companies.
Yes.
They are the consumers. We are the health providers. Like my own social health insurance scheme now.
Yes.
ILERA EKO.
Yes.
We are the health providers.
Yeah, the health providers.
So let's assume I just walk up to a man and say, okay, sir, Mr. Hey, if you register with this our health provider with a token of maybe 15,000 naira for individual, so we are ready to give you all the benefits. These are the benefits you are entitled to in our health insurance. And Mr. A take the benefit package and look at it and say, okay, this thing is fantastic. Okay, you are telling me if I should register on this health insurance, I'll benefit all these things. And I say yes. Now the man says, okay, give me the form, let me register and make payment. It has become an agreement between us. Okay, you have made payments and I'm ready to give you the quality health service that you needed. That's what health insurance. Okay. Another question you have there is
why is it important?
You say, why is it important? It's important because this health insurance reduces the unexpected high medical bills in our various hospitals. When you register health insurance, like someone is sick now.
Yes.
Now, for you to treat typhoid or malaria now, in Nigeria today, in our Lagos today, it will take like 50,000 or 80,000 naira.
If you go to a hospital?
Yes. If you are not under health insurance.
Yes.
But you register with health insurance with a token of 15,000 naira. From the whole year.
Covered for that.
For a whole year. For all 12 months calendar. And you can treat malaria. You can come back in the next 2 months and say, okay, I'm having malaria. They'll treat you. But for someone that's it's not under health insurance.
Each time you come to the hospital, you have to pay.
Your registration, you register, you pay. Maybe it's 2,500 or 3,000 or 4,000. It depends on the hospital, the cost of the hospital, maybe private or general hospital. So once you pay, you make payment. They can tell you, this typhoid is serious. Well, deposit 50,000 or 70,000. But under this health insurance, so it reduces the cost of how people are paying, what people are paying in the hospitals. So it is very important for us, everybody, to key into this scheme. Health insurance,
okay. Really, really important, of course. So I'll definitely love to know now. There are two terms used interchangeably. We hear health insurance, and then we hear social health insurance. Is there a difference?
Yes.
What is the difference?
Yes, thank you, presenter. I've talked about health insurance generally. Now, social health insurance is government health insurance. Call it social health insurance.
Yes.
It's a government-initiated health insurance.
Okay, so when you hear social health insurance, you know it's from the government?
Yes.
Okay.
It's a government-initiated health insurance for people to have access to care in a very lower amount of money in their various hospitals.
Okay.
You understand? Okay. It's a subsidized health insurance scheme for people to have access to have care to have access to care in their various hospitals. Like like a family of 5, a family of 4, for example, father, mother, and 2 children. It's a token of 55,000 in my own health insurance. We call ILERA EKO.
Yes.
Father, mother, 2 children. Children below 23 years. They have access to care. Maybe someone is sick. The child can be like our weather now. You can see our weather now is very cold. Everybody's sickness is everywhere.
Yes.
So
people are feeling
ill. So a father can be sick, mother can be sick, even the 2 children can be sick. They'll be admitted in hospitals.
And if you were to go to hospital, you'd pay for each of them separately.
You register each person. If you are not under this health insurance, you register in the hospital. Registration, you have to register. You give you a card.
Yes.
But under the registration is free. Even consultation is there. So those are the benefits that people don't know, that this health insurance, this social health insurance is very good for them. If 50,000 naira for a person individual. There's a man walked up to me. The man just called me and said, I heard about insurance on radio. You spoke on radio, and I said, okay. He said, are you sure this thing can cover ILERA? hernia surgery? And I said, yes, sir. He said, no. 15,000 hernia surgery. I said, yes.
Because if you look at the price compared to...
He has been to hospital and they told him he's going to pay 250,000 naira for the surgery.
Yes.
And I said, sir, let me send you the form, register, and you make payment. And next month, come and see what will happen. He did. At the end of the day, the man did the surgery. Today, the man is one campaigning for me. I was preaching the gospel about ILERA EKO. So it is.
And the truth of the matter is, when someone like that, his voice will be the strongest. That's the highest form of advertisement. When you have
the surgery, the drugs, the admission, everything.
Everything.
I'm telling you.
You didn't pay anything else.
Yes.
That's quite amazing. That's quite amazing.
Yes.
So social health insurance is government
initiated program scheme.
It's government initiated. So for everyone.
Yes.
Okay. That's how it's different from the general health insurance.
We have private health insurance.
Yes.
There are companies. We have some companies that private health insurance
that provide such health insurance cover.
But their own will be better than our own.
In terms of price,
premium.
Yes, the
premium. Yes, but this one is subsidized to the level that 18 years boy or girl can pay.
Okay, so that's another difference.
Yes, someone that's using 250 phone can buy 15,000 health insurance. But compared to private, single, individual can be 100,000 or 150,000 individual. But this one is just 15,000 for you.
And that covers yours.
Yes, covers for a whole year.
Right. Quite an interesting topic. Really interesting. And I know, of course, my listener, you definitely want to weigh in on this. I would definitely love to hear from you. If you have any question, any grey areas you don't understand, or perhaps you just want my guest, Mr. Omotayo, to shed light on a part you don't really understand, I'd love for you to call in 091-538-77127. That is 091-538-77127. If WhatsApp is your preferred medium, 080-991-20777. I just want to quickly let you know that we have an incident report. 40 feet loaded containerized truck having rear tire problems at Marine Bridge by Dan Lamy in Igomu. Okay, I understand caution cones have been placed and a tow truck has been contacted. It's not really affecting traffic at this time, but just to let you know as you head in that direction. 40 feet loaded containerized truck having rear tire problems, and yes, at this time caution cones have been placed and a tow truck has been contacted. It's not really affecting traffic at this time on that stretch. Also, around the Ejigbo axis, vehicular movement from Old Garage in what Ikoto intersection is good at the moment, and the Ikoto intersection in Ojodo is busy due to commercial activities. Return trip Ojodo to Ikoto intersection connecting Old Garage is busy due to alternation ongoing. Synagogue to Ilewe, Selegbe, Power Line, Iyano Ejigbo, NNPC junction is moving smoothly. Jakone Gate to MRS is busy due to alternation and a bad portion of the road outbound is free flow all the way through to Kwako. The return journey from Kwako in Northern NPC Junction down to Iyano Ejigbo through Ilewe down to Ojodo is in good shape at the moment. Bubo Stick in North Kenu is a steady one, while the return journey is moving faster. No impediments, and we have traffic managers well placed doing the needful around that axis at this time. Yes, on the front burner today, it's all about the basics of health insurance, and my guest, Mr. Idowu Omotayo, has been taking us to the classroom, giving us a bit of a lecture and a strong foundation as regards the basics of health insurance and social health insurance. And he's been able to establish that, of course, social health insurance, how it differs from just health insurance is that it's government motivated, it's government powered, so to say, and the government is at the forefront of that, giving us health coverage at very minimal cost. Yes, and the truth is, like I said earlier at the very beginning, nobody plans to fall ill, but it's always nice to have a safety net, something to fall back on, even with minimal resources. Now, moving ahead, Mr. Omotayo, yes, we've talked about all this. It's really, really important. Of course, we can see social health insurance for residents. It's quite important. But I know there are a lot of, myths, so to say, a few things people hear about health insurance, and we whisper about this and all that. Are there some myths you'd like to dispel today about health insurance? That things that they are not true, that people say, health insurance, if you do health insurance, this one, you go there, they will tell you that it's not covered, it's not. In the end, you still pay. Things like that. We hear that a lot. Okay. Would you like to dispel some of those myths?
Yes. The first thing I first say is that the first thing people might say, you are still young to register for health insurance now. It's for senior citizens, it's for other people. You are still young, maybe 18 years, 20 years, you are still young. And it's a lie. If you are 18 years above, you can register as an individual. So it's not like maybe it's a senior citizen like 60 years, 80 years that can register, or 100 years. So from 18 years above, you can be on this scheme.
Yes.
So you can register as individual. So if you are coming as a family, maybe family of 4, you can register. So that one, people are saying it after, no, I'm still young, I will drink, I will take paracetamol and I'll be okay. No, you have to take care of your health. If you are 18 years above, you can register. If you are 6, 17 downward, you will be a dependent under your parents. Do you get? So family of 4, okay, I have 2 children, me and my wife, and my 2 kids. They are under 18. No, I will register them. They will be under me, and they will enjoy the scheme. Now, another thing that people used to talk about, they say, oh, if you register, they will skip some things, they will restrict something like maybe some surgeries, some important treatment is not covered. No. That is why the first thing to do is to tell an enrollee, because an enrollee that, okay, these are the benefit package, these are the what you enjoy, these are the what, when you go to the hospital, these are the entitlements, these are the benefits that you get. You show them, you yourself, you see it, okay, this thing is covered, this one I like this one is covered, everything that is covered, you see it under the scheme before you even register. That will interest you, that will give you an interest, okay, all these things are covered under the scheme, okay, I will register. So people are saying this is not covered, don't listen to them, they will not answer you. If you register, they will not treat you well. All this thing is not true. So that is why we are on radio stations, we are on television stations, all our social platforms, maybe Instagram, Twitter, TikTok, Facebook. We have been going around to tell people, and even televisions. And even we are doing door-to-door sensation to tell people. If you say you don't go to
the gospel of ILERA EKO.
I don't go to radio, I don't go to televisions, I don't have a big phone, I don't have Android phone.
I will come to your
doorstep. We are doing that now. Door-to-door sensation. I will knock your door and say, oh, Mr. Ojo, are you in there? Let me tell you about ILERA EKO. So we are doing that now. So that for you to know that, okay, this thing is good for you and your family.
Amazing one. So already you're handling those myths. You're trying to cope with the myths, and it's a good one. Any other myths we should know about? Any other misconceptions people have about?
Yeah, people will just say, oh, if you register, don't mind them. If you go to hospital, they might give you ordinary paracetamol.
Yes, we've heard that. Someone has called on radio and told us that.
Someone has told me that, they will just say, paracetamol, go. ILERA does not cover this. Go. ILERA does not cover. It's a lie. I have a call. Let's take this. Because you don't. Okay.
Yeah. Hello. Good morning.
Hello. Good morning.
Yes. Who do you have on the line? Yes. Good morning.
Yeah, my name is Andrew.
Andrew, great to have you with us. Welcome.
Yeah, I'm enjoying you and the guests.
Okay.
The meat and the fishes.
Meat and fishes. I see what you did there.
So somebody said a mother.
Yes.
Is a mother of about prosperity had a challenge. She now went to one of the hospitals registered for this health insurance. But they now said, and referred the person to meet again. They referred the person to either St. Nicholas Meet or what is it called? EKO Hospital. Because they don't have the facility.
Okay, is the person already on ILERA EKO? Is the person on ILERA EKO?
Yes.
Okay, please
so
go on.
I now said, well, you go and call Lagos State Health Commission. You call them, you explain to them. They have not gotten back to me. Because these things, that's why I call it meat and fishes. Yeah? Until we dissect it. Yes. People will always say, I want to go and buy a book, I want to go and buy a paracetamol.
And that's why we're here.
No, you don't need to do self-medication.
Yes. Yes.
The analysis is this.
Yes.
It's health. It's a pool fund.
Yes.
Now, some people may not pass through health challenge in 1 year, and some may pass through it. But it's of advantage for one to do it. But the myths there are the things I want him to dissect and give assurance for. Because referring someone to another hospital from the hospital the person is before on that health insurance. I don't know how it works. Thank you.
Very much for this. Thank you very, very, very much for this, Mr. Andrew. So part of advice and part request, dispelling the myths, so do you have anything to say to this, Mr. Omotayo?
Yes, concerning what...
Sorry about that. Okay, go on.
Concerning what he said now.
Yes.
There are some hospitals, they don't have the facilities or what that enrolling want to access care for. Okay. Maybe in my own hospital, eye care is not there. We have to refer you.
Because you are covered. Because
you are covered. We have to refer you to a better hospital that have that facility, that where you can access that care. Do you get? So, as someone that's okay, dental care, and my hospital don't have dental care, okay, I'll say, okay, that hospital, we beckon on to ILERA EKO, and say, okay, this really want to access care on dental care. So, and we don't have the facility here. So, ILERA EKO will then say, okay, refer him or her to this hospital, maybe general hospital or any other private hospitals that have that facility.
So that's what happens in that instance.
And they will go there and access care free.
Okay.
Because all those hospitals, they are under ILERA EKO.
Okay, even though that's not the hospital you...
Yes, you go there and access care.
Okay. Mr. Andrew, I'm sure you got that clearly. So in that instance, I think that's what happened.
That's what happened.
And they had to move,
they have to move
the
you.
person to...
Yes. We are there to give a quality service.
Yes. Okay, so there's something also he pointed out, he shed light on. And someone has called on the show once and said, from January to December, I didn't fall sick, and I'm already on this scheme. And what will happen? When they give me my money back for that? And so would you want to respond to that? I know it's funny. But
yes, that's what we call it. That's what we call insurance.
Insurance.
Now, for those that have cars, if you insure your car and you don't pay for accidents, you don't have accident throughout a year.
Will you go and collect
insurance? Insurance is your money back. No, and the next year you have to renew it. So that's called health insurance. That's perhaps something happened to me and I didn't have much in me.
Yes.
Or something happened to my kids, I didn't have much. So how will I take care of it? No, you go to hospital, go and have 100,000 naira. Or someone to give birth. They said, okay, go and have 300,000, 350 for CS. And you don't have that kind of money. For 55,000 naira, your wife will deliver through CS. Yes, on this scheme.
And people, if people find it hard to believe.
It is hard.
I think we should have an episode of the show where we would have testimonials. It just be all about testimonials.
That will bring really
yes
to come to radio to come and testify. Yes, we'll do that.
Because that's the best form of advertisement. Someone CS is about how much is CS now?
Be private hospital or general hospital. You have at least for general hospital now, the least you can get CS now is 150, 200.
No.
But private hospital don't let that go there.
Beyond.
Like with 3 or 4 or 5. So, yes.
And once you are enrolled on the scheme, you do that for
55,000 for family of 4.
That's amazing.
Family of 5, family of 6, 80,000.
So just like some people believe that they will not get quality treatment. Even with all what we're saying, under a social health insurance plan. I've had people. In fact, someone was asking today, can I do both government and a private HMO? It was a question that came in. Even that just while those call was on. Some people believe they will not get quality treatment under a social health insurance plan. So some of them, even because of lack of faith, they say, okay, I'm a government worker, I'm this one, I'm already here. Well, they used to have one as backup. So let's try to dispel that myth. Let's talk about the benefits what you get to enjoy under ILERA EKO. Let's refute all the myths and legends, so to say.
Okay, concerning that, they will enjoy quality health service in social health insurance, like in this ILERA EKO. I can guarantee them. If you have private HMO, well, it's good for you. But this our own is good for you. Subsidized health insurance scheme. Understand? Very subsidized to a limit that someone can afford. Now, talking about maybe when you go to hospital, they will not take care of you. They will take care of you. That is why we have different departments that monitors. We have medical departments that monitors how the hospitals, what they are doing there, how are they attending to our enrollees.
Okay, there are people you can actually get feedback to if they are not doing well.
And we also have a call center number. Okay. People that are there 24/7, even in the midnight, you can call them. That I'm so hospital, they didn't take care of me very well. They would at least they will answer you. They will tell you what to do. So we have those things on ground. And now to talk about our benefits.
Yes.
Yes. It's very much, but I'll just mention a few because of time. I'll just mention a few. Let us start from registration. In any hospital now you go to, you want to register, you are not under SMO, you have to register to get a card.
Of course. And
Like
that comes with a set.
Like that's a Nicholas you mentioned.
Yes.
If you want to go to St. Nicholas to go and to register for this, you pay like more than 5,000 naira. You understand? Please go ahead.
No end to it. Please go ahead.
But other health insurance is free.
Yes.
Consultations is there.
Consultation is
Yes,
free.
it's there. It's free. Yeah, you can see specialists on health insurance. Your gynecologist, your general surgeon, your dietitian, pediatrician, and some others things that are there like that.
All free.
You're
All
free.
part of
You
the
can say, okay,
package.
specialist. I want to see specialist. I want to see doctor to enlighten me on what to want to do or one or two things in my body. So all this is are there. Your dental care is there. Scaling and polishing is there. It's free. It's covered under the scheme. Tooth extraction is covered under the scheme. Your eye care, maybe you're having a eye issue. There's something we call Apollo that everybody knows. You go to hospital. The hospital will take care of you. There's a surgery we call pterygium surgery. Under the scheme is covered. Maybe something swell up in your eye, you want to remove it. So they will do the surgery. Cataract is covered under the scheme. Cataract surgery, it is covered.
I don't know how much that is.
So
Andrew is calling back. Let's take his call. Hello, Mr. Andrew.
Hello.
Yes.
Mr. Akan.
Yes, welcome back.
I'll pass the message. I'll pass the message to the person.
Thank you.
Thank you.
Thank you so
and
much.
the guest there, I would say, is one of the greatest marketer, let me use that word, of our time.
Yes.
Because the way he's caressing it, people need to do it.
Thank you.
No, it's not about going to pay for it and not doing it or clean it.
Yes.
People need to do it because he has explained everything just as if a nursery child learning ABC.
Nice.
So I give it to him and I give it to Lagos State Ministry of Health.
Thank you.
Thank you.
Thank
God
you.
bless you.
Yes, a round of applause for Thank you, Mr. Andrew. Okay, Mr. Omotayo, kudos to you for doing a great job of marketing this. But it's it's believable, and then it's something that everyone wants to be a part of. That's why I said
There is something I don't want to forget.
yes.
You said somebody wants to register. Someone is on other, or someone is under ILERA EKO register private. Now, do you know it has an order now from state government that everybody in Lagos State must have this health insurance. It's mandatory. Let me put it that way. Yes, it's mandatory now that you must have this health insurance. So far, you are residents of Lagos State, and then you are from you are from another country. So far, you are in Lagos State. You must have health insurance. This Lagos State health insurance, ILERA EKO. So it's mandatory now. So everybody must come aboard. We must register everybody. Old, young,
Everybody. So it's now it's part of the law.
Yes, it's part of law now. It's law now.
Okay, so Mr. Omotayo, we need to have people who are on board, who have enjoyed this, not just registered, people who have been treated.
I think we work on that.
You need to make arrangements.
Yes, we
so
bring
that
people, like one or two to come and testify.
Testimony.
Yes, we have testimonies already. We have them. We have many testimonies.
Yes.
Testifiers.
Yes. But we still have a few people who are still skeptical.
Yes.
Who have not. If you ask them, do you even have health insurance? They'll tell you, I don't believe in it.
I was talking to someone and say, it's good for you.
So I'd like for you to advise. Okay, I have a question on WhatsApp. Good morning, sir. Please, can I register my parents living in Ogun State? Do I work in Lagos State?
Yes. It depends on where that person is staying in Ogun State.
Okay.
Akute is Ogun State.
Yes.
Do you know? More is Ogun State.
Yes.
About 4. Even Shango there. It's Ogun State.
It's Ogun State.
So someone can register if the distance is not much.
Okay.
We have
outskirts.
We have hospitals that are very close to that place. Yes, people in Akute can register. We have Ifakojaye. We have hospitals in Ifakojaye. We have hospital in Ogbade, Ikeja here. So it's very close. So and people stay in the way about 4. It's a straight road to Bagada General Hospital. To many hospitals around it. So if that distance is not much for them, they can register their parents.
Great. All right, so we're talking about skeptics and those who have not embraced health insurance. What is your advice to them and how they can join ILERA EKO? Quickly, let's just take.
Okay. My advice for people that have not joined ILERA EKO. Now we are on radio. You are hearing us, or we are going to your doorstep now to tell you about ILERA EKO. Our advice to register ILERA EKO is good for you and your family. And now you can register. We are in all local governments.
Yes.
Just go to local governments. As ILERA EKO, the kiosks there, V-boot there. You see all there. You register, or you can call us, or you go to our website.
Okay, let's just have the numbers real quick.
So okay.
That they can call.
Okay, let me give my number.
Okay.
So they can call me. 00
080
30
30
78
78
98
98
66
66. Okay, we'll take it again.
00
Yeah.
30
30
78
78
98
98
66.
66. Any other numbers we can call?
Okay. Okay. You can call 00
080
02
02
755
755
27
27
462.
462. Okay, and of course you can go to the website www.lashma.com.
Yes.
And if you want more information, I know that of course the head office, Good Shepherd House,
Yes, I
opposite the
was
secretariat. Yes, you can also, if you walk in there, you would also be able to get information, or you can even be enrolled on this scheme. I know we have. Let's just quickly run through all the plans we have.
All the plans we have.
Yes, we have standard Jara plan.
Okay, we have standard Jara plan.
Okay.
We have senior plan.
Seniors plan.
We have standard Jara plus.
Standard Jara plus. Okay.
Yes.
So those are the three plans we have now.
Yes.
Okay, a great one. Thank you very much, Mr. Omotayo. It's been a great time with you
Thank you,
on
sir.
the show, and
Thank you,
I'm
sir.
hoping. You see the way Mr. Andrew hypes you. I'm hoping we'll have you on more editions of this show.
Yes,
Thank you so
yes,
much
yes, thank you
for taking time out of your position.
Thank
I know
you, Sandra. Really.
people in sales, they're always busy, but we're looking forward to having you
Thank
on
you,
other
sir.
editions of the show.
Thank you, sir.
It's been a great one. And dear listener, we conclude today's episode of ILERA EKO Extra with reminding you that health is wealth. So you need to invest in your health, because as you do that, you're investing in your future. Don't wait until it's too late. Get on board ILERA EKO today so you can secure a healthier tomorrow for yourself and for your loved ones. Visit the LASHMA website, www.lashma.com, or any of our enrollment centers to learn more. You can also call the hotline for assistance. A big thank you to Adeyinka Bemigbade, Assistant Director, Public Affairs, LASHMA, for support and collaboration in bringing this episode to life. Also a big shout out to Mininu right here in the studio with us. And my people, my interns, what's your name? Fregene Ogenetega. Okay, and Babatunde Esther. Yeah, thank you so much for doing this with me. To become your way, same time next week. Thank you for tuning in to ILERA EKO Extra on Lagos Traffic Radio 96.1 FM. Until next time, stay healthy, stay informed, and come on board ILERA EKO. My name is Akan Usen, wishing you all the best. Bye for now.
Wizard boy, shall I show it on